Thank you very much. Next, Mr. Henry.
For inviting us to testify today. Natural disasters such as earthquakes, hurricanes, and floods are often frequent reminders that we must be prepared when disaster strikes. And since 2001, the nation has understood the importance of planning for acts of aggression against innocent citizens. The Healthcare Coalition for Emergency Preparedness was formed in an effort to raise awareness and educate people about often overlooked issues in plans to maintain healthcare facility operations during a crisis and to develop efficient methods to reduce healthcare costs in that area. One of the largest hindrances to what we call operational security revolves around transportation constraints to the hospital itself or such impacts on key suppliers and vendors. Well, we've addressed a lot of issues in our full testimony. Today I'd like to focus on one of the issues we have found often overlooked in operational sustainable planning, and that is adequate attention relating to the safe disposal of regulated medical waste, also known as infectious waste. Until the mid-1990s, most healthcare facilities incinerated materials on site, but the federal government banned that practice. The current practice for most healthcare facilities is to manage infectious and contagious waste by transporting such materials over our nation's highways, through our cities and neighborhoods, by non-clinical commercial truck drivers to a regional facility to be treated and disposed of. Under a widespread community emergency, facilities would be inundated and supply management would be stressed. The Joint Commission requires healthcare facilities to be self-sufficient for 96 hours. However, the volume of hazardous medical waste would dramatically increase when there's a surge on a hospital's capacity due to a large population suddenly contracting a contagious disease, such as in a pandemic, or a natural or man-made disaster. In addition, the U.S. Government Accountability Office and other reports have warned that waste disposal would be near impossible for quarantined or isolated healthcare facilities that have outsourced the responsibility of sterilizing contagious materials. Because the primary method of controlling the spread of infection and avoiding pandemic is quarantining, the development of an on-site approach to waste disposal appears to be the most appropriate one. Further, various reports by health officials and other experts have recognized that on-site medical waste treatment is the best practice for emergency preparedness and pandemic response. Taking an on-site sustainability approach not only helps address a hospital's ability to handle a crisis, but also issues with off-site providers that would occur in the case of a pandemic or crisis. Vendor problems, including transportation constraints and staff shortages, would be out of control of a healthcare facility. Fortunately, modern, affordable technologies exist that can cleanly, safely, and economically sterilize infectious and contagious medical waste on the premises of healthcare facilities. We'd also like to point out that installing on-site waste sterilization equipment at VA facilities would provide ancillary and immediate benefits for the VA beyond emergency preparedness, including cost savings and carbon emission reductions. Expenditures for on-site treatment of infectious waste is perhaps the only preparedness tool that would pay for itself from the day of installation, as this equipment often produces a return on investment, a payback between 18 and 36 months. We estimate that on-site treatment using sterilization equipment can produce an average cost savings of $1.6 million per hospital, which would equate to about $190 million if installed at all 117 VA medical center hospitals that are currently relying on off-site vendors to haul and treat their waste. Further, regarding the VA's ability to comply with Executive Order 13514 to reduce carbon emissions, the Coalition has developed a carbon footprint calculator that can calculate in real numbers the reduction in pounds of CO2 emissions each year for those facilities that install on-site waste processing. We have constructively urged that on-site sterilization capabilities be added to the VA's list of best standards and practices, as well as to the list of mission-critical components in their emergency plan. Currently, 24 VA facilities process their waste on-site. We know that many facilities would like to add this component to their capital budgets, but thus far have not done so. We do know that there are groups within the VA that are looking at this very issue and recognize that on-site medical waste treatment could benefit VA facilities from an everyday operational aspect as well as emergency preparedness. Our nation remains vulnerable in the area of contagious waste management during a pandemic or a crisis. We have prudent alternatives that should be a best practice for emergency preparedness and facility operations at the VA. Again, thank you for the opportunity, and I look forward to your questions.
Thank you, Mr. Henry.